making the trek over here in the heat. That shows true dedication. So my name is Andrea Parker. I am an assistant professor here at Northeastern, joint in computer science and health sciences, and I'm very new here. So I started in January, so I moved up here from Atlanta. So the work that I'm going to talk about is research that I did while down there, but work that I'm building on here as well. And so if you have questions during the talk, feel free to ask, or I don't know if that's going to mess with the plan, but if not, we can talk afterwards as well. And I'm going to go over a variety of projects briefly, so if you are interested in more details, just ask. So, my background is in human-computer interaction. Does anyone know, besides people I've talked to about it here, does anyone know what this field is? Familiar with it? So I'm trained as a computer scientist, really, and my specialization is in human-computer interaction, which is a discipline that's highly interdisciplinary. We look at, sort of when people think of computer scientists, they think about someone in a dark room typing away to a computer and programming it to do all kinds of crazy things. That's part of what I've been trained to do, but what I'm much more interested in is trying to understand how technology can affect behavior, how to design tools that people really want to use because the systems reflect the values that people have. Trying to understand how we can use technologies to fit within existing social patterns and interactions and create new ones. And so the process that I engage in is very iterative, where I start with evaluations. I do a lot of qualitative field work to understand what do people want, what needs do they have, how can we innovate, translating those findings into design ideas and prototyping interactive systems to address the issues that I found in my evaluations, and then doing evaluations of those systems. And then my work is all focused on how all of this can be applied to health. And so, of course, my research is also informed by health behavior theories and intervention models from public health. So, my work is motivated by the fact that this is not where we're seeing health management happen only anymore. So, it's not just that you go into your doctor, to the doctor's office and get some recommendations for how you can improve your physical activity or your eating habits. Instead, health management, health promotion, health care, all of those things are really, of course, I know I'm sort of preaching to the choir here, but moving outside of the boundaries of the hospital walls. So we're collecting information about ourselves, we're visualizing information about ourselves in ways that we've never been able to do before. So this is exciting. We see lots of devices available commercially, lots of apps in the App Store, but there's been little examination of how effective these tools really are in terms of changing behaviors, attitudes, but also in terms of facilitating engagement, getting people to actually continue using them. What is it about these kinds of tools that makes people want to use them or makes them not want to use them? Those are kind of the questions that I'm interested in. So I'm interested in technology, not just because I'm a computer scientist, not just because it's everywhere, but for three reasons. One, that the kinds of digital platforms that are being developed today are extremely portable, right? So they're going with us into all of the different settings in which we're doing health, the settings in which we're trying to make health-related decisions. It also has the potential to be incredibly engaging, to transform sort of dry recommendations for how you need to improve your diet into really sort of immersive and compelling forms of information that have the potential to be more persuasive. And then third, something I'm really interested in is the way in which technology is an enabler for collective action. So we've seen this outside of health, right? So we've seen Twitter being used in political context to help people organize protests. And we're also starting to see it being used more in the domain of health. So has anyone ever used the Eatery application? So we can debate about whether or not this is a good application of this sort of approach, but the idea here is that, there are a lot of tools that let you create a personal diet log. But here the idea is that you create your diet log by taking photos of your meals, but those photos go into the cloud and a bunch of strangers out there evaluate it. The idea is that if we can just get enough people to do this, we might come out with something reasonable. So again, we can debate whether or not this is the right way to do this, but it's interesting to think about how technology can really take things that we've been doing for a long time and make them potentially more engaging, help people work together to address issues like managing your eating patterns. All right, so there's tons of devices, tons of applications out there, which is very exciting. However, a limitation of this work is that a lot of these projects, commercially and in research projects, have looked at disease at the general population level. So how can we help Americans be more physically active? How can we design a device to do that? How can we help even looking at diabetes? How can we help diabetics better understand how their glucose levels are tied to their eating patterns? Things like that. And those kinds of systems are very useful, but there's a problem. Health outcomes don't look the same for all segments of the population, right? So if we look at the African American population, which is the demographic that I've done most of my research in, we see that diabetes is far more prevalent. We see that obesity is far more prevalent. So all of these diet-related health challenges are more prevalent within this population. So because of this, of course, federal agencies, health researchers have advocated for targeted interventions trying to address these issues. But we don't see technology following suit. We don't see targeted designs for these particular populations with an understanding and appreciation of the particular concerns that might be at play here. And then furthermore, I'm sure we're all aware, when we drill down to low-income neighborhoods, we see individuals facing particular challenges. Of course, we see food deserts in these contexts where access to healthy foods is much lower, and the prevalence of unhealthy foods is greater. So my research is motivated by all of these things, and I'm going to talk today about work that I've done looking at how we can encourage healthy eating practices, particularly within African Americans living in low-income neighborhoods. And I'm motivated by the fact that health disparities are not just do not just exist because of biological or genetic traits, but that research has consistently shown that the social determinants of health are really important to consider, as well as how culture shapes eating practices and values that are relevant to an individual's pursuit of healthy living. So this is the question that I'm going to sort of get at in this talk. How can technology help users overcome the limited access to healthy foods in low-income African American neighborhoods? And I'm going to, like I said, go over 3 projects pretty quickly. The first project that I'm going to talk about is research that I've done looking at casual mobile games. So does anyone know what a casual game is? Has anyone played Diner Dash? Diner. Okay. Bejeweled or any, okay, so these are casual games. Essentially, they are, I'll explain it here. They're games where they're very simple to play, to learn how to play. You don't need to, spend ages talking to other people who are, really into that game to learn how to navigate different levels. You pretty much get the idea very quickly. Also, they're often played in short bursts, so they're particularly useful when you're waiting for a train to come or waiting, for an appointment. And the barrier to entry is very low. So we see a much more diverse demographic in using casual games than we do in more intensive games that you might expect to play on a gaming console. So far more women, for example, playing casual games. So I was interested in exploring how we can design casual games to promote healthy eating, and specifically designing them for the mobile phone platform. And I was interested in doing this because within my demographic, looking at individuals in low-income neighborhoods, right, this is one computational platform where we see, you know, a great distribution of even within this demographic. And so this game, this work was done in collaboration with Reach for Wellness and Humana. And the goal in this game was to teach players how to make healthier decisions when eating out at local restaurants. So I've explained what casual games are. I'm going to play a little video that shows the game being played. But essentially your goal is to serve the customers who come into your restaurant as quickly as possible. So you're assuming the role of a restaurant server. So it takes you through these series of screens to explain what I've just explained to you. And then, it's a little hard to see, but essentially people from your community come into your restaurant and you're shown a subset of the menu and you have to decide which of these 3 items is the healthiest and recommend it to them. And as you make your selection, you receive simple stoplight feedback. A red light flashes if you've chosen the least healthy option, a green light if you've chosen the healthiest option. And all of the items that are shown here we created a database of foods based on foods that were actually available in the neighborhoods that our participants were living in at the local restaurants. So there was a lot of items that you would find at fast food restaurants, as well as soul food, traditional African American cuisine dishes. And so the idea here is that this is the reality in terms of when people go out to eat in their neighborhoods. These are the kinds of foods that are there. How can you help them make a healthier choice if they're going to those places? Any questions so far? Okay. So we ran a small qualitative field study to examine, do people find this game to be fun? And beyond that, does this game show the potential to help people move towards increased wellness? So we conducted interviews with participants. We did a diary study where participants were keeping logs of everything that they were doing with the game, and our analysis of the interview transcripts showed several ways in which participants were actually beginning to engage in different processes of change. So using the trans-theoretical model, which does everyone know trans-theoretical model? Okay, so essentially a health behavior model which models people's progression from not thinking about making a change to a behavior all the way to making a change to maintaining a change. And the model lays out several processes that help people get from one stage to another. And so we saw participants, for example, engaging in helping relationships. So the fact that the game was on their cell phone meant that they were playing it in a variety of social settings. So they were at work, on their break, and they would be playing it, and people would be looking at them and saying, "What are you doing? You're laughing over there. What are you doing on your phone?" And they would tell them, "I'm playing this game." The coworker would come over, and that would spark a discussion about what's happening in the game. And that discussion led those participants to then realize, oh, I can actually talk to you about healthy eating. We've never talked about it before, but this game sort of was a catalyst to them identifying this is a person I can talk about healthy eating with. We also saw this happening in families. So parents, these were all adults that were in our study. But of course, they had something new and exciting on their phones, so little kids, their children were interested in what was happening. And as parents played and then let their child play, it stimulated opportunities for them to discuss what had actually happened in the game. And it was exciting to see this happen sort of naturally, suggesting that this is an authentic interaction. So when we're designing these sorts of things where we're trying to blend education with entertainment, of course, finding that balance can be challenging, and not making it feel like it's an assignment, it's a task, but that it's actually an authentic, entertaining experience. And our participants discussed how it did feel authentic in that way. We also saw participants beginning to engage in self-reevaluation. So I mentioned that the foods that were in the game were representative of foods that were in the neighborhoods in which our participants lived. And so they discussed how, because they would see foods that they love to eat show up in the game, and show up, for example, continuously receiving a red light, how they were, sort of beat over the head with the fact that, wow, this is really not the healthiest thing for me to eat. But not only did they see that, they were given sort of concrete ways in which they could improve. So not just don't eat this, but okay, this other food is a little bit healthier than that. And so that felt like, okay, that's a small step that I can take to improve my habits. It's not someone saying you have to completely overhaul your diet right now, but here's an incremental step you can make. So now I'm going to switch gears and talk about, the next two projects. I'm going to shift gears here, moving away from gaming, to talk about how I've tried to look at the ways in which technology can support community health advocacy. And this work is really motivated by the fact that there have been several public health interventions looking at how we can help empower residents to care for the health of their community by, for example, supporting them as lay health advocates, supporting them in their efforts to share information with their local community about how they can utilize local services or, for example, eat more healthfully. So we wanted to look at how technology could potentially facilitate community health advocacy and expand the impact of one's efforts by connecting people to a larger group, but still within their community. So the first project that I did was designing a system called Eat Well. Again, here I used the mobile phone, and I really tried to brainstorm here how I could come up with a system where people could use a very basic phone, where they wouldn't actually have to install special software on it, so that we can reach the broadest potential demographic while still focusing on people with cell phones. And the way that it works is people use their existing cell phones to dial a phone number, which connected them to our software. And when they were connected, the software told them that they could listen to or record their memories about how they've tried to eat healthfully in their community. And the idea here is that while if you look at a neighborhood, you may not have anyone who's a nutrition expert. Our formative research, where we went in and did several focus groups in this community, suggested that people did have their own strategies that they had developed for overcoming the barriers to healthy eating in their neighborhoods. And so this Eat Well system tries to make those strategies more accessible to people in the neighborhood. So that's the way the system worked, and we conducted, again, a 3-week study to first understand, is this a compelling system for people to use? Do people share and listen to memories in this kind of system or not? And if they do, what kind of content do they share? So I'm going to talk about a few sort of findings here, but again, if you have more questions, let me know. One of the things that we found was that when people created these clips, they weren't just, hello everyone, you should really replace one of your sugary beverages with water each day. They weren't those sort of generic tips. They were really these short, usually a minute or less, but very intimate and personal stories about how people had overcome barriers, their small and large successes. And they talked about their families, they talked about their loved ones, they talked about, just going through their day and wanting to get something to eat. They really brought their stories to life as they spoke about them here. And we were surprised at this because you're basically calling and speaking to, you have no idea who's out there. You know that all of the people are generally living within your same geographic area, but this was surprising. And so part of what can help people to keep coming back to listening to memories in this system was this intimate quality, but also the emotive quality of these memories. So because people were speaking about their experiences and not just writing about them, for example, as we see in a lot of online health communities, that voice, that audio quality was really what helps people be able to hear the joy, the excitement in people's voices, and it made them want to keep listening. And then finally, participants really described how they were excited to see the sense of interdependence that was exhibited. So essentially, the fact that people weren't just caring about their own health, but they cared enough to share these memories where really it was not benefiting them at all, but they were doing it to benefit and try to uplift the community. And they talked about how this gave them a sense of hope, one for themselves, and that they can potentially eat healthier themselves, but also a sense of hope for their community. And I want to just play on, let's see, hopefully this will work. Play a clip, one of the memories that was shared.
I have a great memory for a lentil loaf. I actually got it off the Food Network. That Italian cook really, what they say is so sexy, did a lentil loaf. So it's like, only it's made with lentils. And it is absolutely fabulous. It took me a long time to make it the first time. And I actually, as I was making it, I said, I am never doing this again because it's just too much trouble. In reality, it's not that much trouble, but you just got to remember to soak the lentils like a day ahead of time. It is so good that my class, 4.5, wanted to take it for lunch the next day and asked if we had any extra to take to her teacher. There you go. It must be really tasty. Good and good for you. I also gave the recipe to a friend of mine who is vegetarian. She said she has made that lentil loaf 5 times since I gave it to her. So, give it a try.
So I'm going to wrap up with this last project, which was looking at another way of supporting community health advocacy, again looking at helping people to share their experiential knowledge around healthy eating. This system is called Community Mosaic, and this work was done in partnership with the YMCA and Humana. And the way that it works is, so Eat Well was all audio, and Community Mosaic is all visual. So people use again, their existing cell phones to take photos of anything they feel is helping them to eat healthfully in their neighborhoods. And then they write an optional text message describing this experience. So this is, something that they're making at home, a food that they're eating out at a local eatery, or even a picture of an establishment itself. Like if they find that there's some restaurant that actually provides healthy options, they can snap a photo of that. And then they send the picture plus text, or they can send one or the other, to the Community Mosaic phone number. And then their message is displayed on this touchscreen display that we installed at the YMCA. So this is a larger version, a screenshot of that visualization. And the buildings are meant to be evocative of the Atlanta skyline. All of the text prompts in the system are really community focused. So our goal here was really to sort of design for this idea of collectivism, the idea of a community coming together to care for itself. So people are prompted to share messages not for their own benefit, but for the benefit of others, to inspire others. And each building window here represents one message that has been shared. So as new messages come in, the building windows flicker on, and people coming by the display can press a building window to expand it and reveal its contents. And this is an example of one message that was shared during our study. So you see the photo, the text that this person has written, and all of the messages are displayed anonymously, but they are grouped by person, so you can scroll through and expand messages to get a sense of different people's history of experience. And then on the right-hand side is a way for viewers to, in a lightweight way, share their reactions to the content they're viewing. So this was in the YMCA, so people are coming here we're coming in for a variety of reasons. Some were going to engage in physical activity. Some were going to just drop their kids off at daycare or different sporting events. And so people were coming in and out. So we wanted to give them a quick way to share their reactions. For example, they can press a button to say, "I'm inspired to try what I see here." And then once a week, sorry, the image is hard to see, but once a week, content contributors received a personalized text message on their cell phone that let them know how many times people were inspired to try the messages that they themselves have sent. So this provides a little bit of a feedback loop to help people know the impact that they're having. So we conducted a 12-week study this time. A little bit of information on the usage patterns. 279 messages shared, on average a little over 60 messages opened each day. And I'm going to talk about two findings briefly. One, our participants described, so we conducted interviews, follow-up interviews, focus groups, log analyses of the logs that were logging people's interactions with the system, content analysis of the messages, a lot of analysis. But one of the things that came out of our interviews and focus groups was participants confirming what the literature tells us, right? That there's an abundance of fast food in their neighborhoods, and there's a challenge of finding healthy foods in these neighborhoods. But they specifically talked about how they felt that prior to Community Mosaic coming in, these vendors were really drawing people to those unhealthy foods, number one by their physical presence, but also by the proliferation of advertisements for these foods. They would get flyers in the mail constantly, drawing them to these foods. And they talked about how the physical presence of Community Mosaic in their community was a way for them to take back a little bit of that power and to also try to draw people to certain foods, but towards healthier foods. And so this sort of persistence of the display, the fact that it was always on in the neighborhood, helped facilitate this, in a small way, countering of these local barriers to healthy eating. And so this is just a quote that was echoed by many of our participants, that they felt that they're the ones to spark change, and they have something that's constantly giving them ideas of how they can, not just go to Wendy's to get that 99-cent burger, but maybe go get a sandwich with lots of vegetables in it. See lots of vegetarian shout-outs today. So in addition to this, we were really interested in, does using a system like this impact participants' sense of their identity as a community health advocate? And we found that, yes, so by the end of the study, participants felt significantly more strongly that they can advocate healthy eating to others within their social network, and that it's more important for them to do so. And so this is exciting because it suggests not just that a system like this can sort of act as an information gateway, but that it can help people to begin to develop their skills to go off even beyond their use of the system and potentially impact their networks. And so, again, another something else that I'm beginning to look at in my current work is how can we specifically design for this sort of broader impact, and how can we assess to what extent using a system like this has implications for the participants' social network in terms of the transmission of encouragement to eat more healthfully, for example, in this case. And so some potential explanations for why we saw these changes happening that came out of our qualitative data analysis. Participants discussed that, this system was really provided a safe and non-threatening environment for them to practice health advocacy. So because it was anonymous, because it really didn't take much effort to snap a photo and send it to the system, they actually got the opportunity to practice something that they might not have really engaged in before. And seeing their ideas up for public consumption and receiving that feedback, made them feel that their ideas were important. I'm up on this display. One participant said it made her feel like she was published. And so these are some potential reasons for why we saw these shifts. All right, wrapping up. So I've talked about 3 different projects today that really kind of give some examples of the kinds of work that I do and the kinds of questions that I'm interested in answering. And sort of I'm going to list 4 directions that I think future work should focus on, and they're directions that I'm focusing on too. So if you're interested, let me know. But I think that casual mobile games really have a unique potential to facilitate processes of change. For the ways that I've mentioned previously, they're with us in the variety of contexts in which we do health. I didn't mention that some of our participants in our evaluation of Order Up the game did talk about how they would play right before their lunch break, and how when they went into the restaurant it would make them think, oh wow, yeah, maybe I should get something slightly healthier. And so I'd like to more systematically examine that finding. Community-driven, I think there's so much opportunity for designing community-driven systems. We see a lot of systems focused for individuals, maybe systems, connecting friends, typical sort of social networking systems. But focusing on the community as a unit of analysis has been under-examined, so I think there's a lot of opportunity for exploration there. I'm really excited about this idea of designing for experience monitoring. So again, we see this sort of quantified self movement. I showed the Jawbone Up. Fitbit has come up with their new device, which are all great and exciting. But typically, these kinds of systems help us monitor our behaviors that we did engaged in physical activity. Even how much of it we did, but not what was it like for me to engage in that activity. How did I feel after I, went for that walk? I felt more calm, and when I went out for a walk with my family, we actually told jokes and had fun, and we were surprised. If we can help people to monitor that and reflect on that, I think there's so much potential. So I'm working on that, and beyond mobile. So I do a lot of work in the mobile space, but I think that public displays are really interesting to think about, and again, under design for when we think about health. Lots of people doing work on mobile health, but public displays, thinking about how they can really act as sites of information dissemination, but also sites where people can come together and deliberate on information. So I mentioned the community Mosaic system, and one of the things we found was, pairs of people coming up to the display and talking about what they were seeing. And because of its size and sort of innovation in multi-touch displays where multiple people can be doing things on the display, I think we can potentially think of interesting ways to leverage that kind of technology for health promotion. Okay, finally, just a plug for our new doctoral program in personal health informatics. We're doing work like I'm doing in behavior change, but also really interesting work looking at For example, individuals with speech disorders and how technology can help them. Lots of work looking at autism, all kinds of research. If you know of anyone who's interested in this program, feel free to have them contact me. I just want to acknowledge my community partners, collaborators, and funders of this work, and thank you. Take more questions. Okay, so tips for people that are interested in going into science and technology. So first, if you are a high school student, I would say, or high school or college student, I would say don't be afraid. So many people are, think that they do not fit the profile for, a computer scientist or an engineer. I felt like that. I still feel like that at some times. But there is no profile. All you have to have is a love for innovation, for creating things, because that's what computer science and engineering, I think, really afford. So that's a tip.